I'm sure you've heard the news. Female catheterization doesn't have to be daunting. Let's simplify it together. First, gather all your supplies, sterile gloves, catheter kit, antiseptic solution, and lubricant. Make sure your patient is comfortable and explain the procedure to her for reassurance. Start by washing your hands thoroughly. Put on your sterile gloves and use the antiseptic solution to clean the patient's perineal area, moving from front to back. Next, apply the lubricant generously to the catheter tip. Gently separate the labia with one hand and hold the catheter with the other. Slowly and steadily insert the catheter into the urethra until urine begins to flow. Once you see urine, advance the catheter a little further to ensure it's fully inside the bladder. Inflate the balloon, if applicable, to secure the catheter. Finally, attach the catheter to the drainage system and ensure it's positioned comfortably. Remember to monitor the patient closely and document the procedure. There you have it, simple steps to master female catheterization. You've got this.